Hi everyone, my name is Zislis, owner and founder of ModernMed Concierge. I am also an ER physician working here today in the ER at Greenwich Hospital. Just wanted to give you guys a glimpse of what it's like on the front lines in terms of what we're dealing with, both from a physical and psychological perspective, and some of the challenges that we're facing as physicians and as a healthcare system. So there's no doubt that the hospitals are being stretched to the max. We are at full capacity in our ER currently, with several patients waiting to be admitted upstairs. The majority of the patients are quite sick and are presenting with COVID-like symptoms. As far as the hospital system, I think that we've done everything that we can do to remedy the situation and make room for the sick patients. We've canceled elective surgeries. We have designated an entire floor in the hospital for COVID-19 patients. Our ICU capacity has essentially tripled since the start of this pandemic. Aside from the physical exhaustion, which is real, we're working our shifts, sometimes filling in for other physicians that are currently out. There's also the mental and psychological aspect of the job. There's so much information that is being thrown at us every day. There are new numbers, new protocols, new new medications. So it's really hard to kind of keep up with it all and stay on top of it all and maintain your sanity. One of the things that is really trying on the healthcare staff is the shortage in supply of personal protective equipment. We certainly have to ration all the things that we use to protect ourselves: the gowns, the masks, especially the N95 masks, which are in really short supply. And we have currently instituted a recycling or re-sterilization policy where we basically use an N95 mask for the duration of our shift, in between patients putting it into a paper bag, which then at the end of our shift goes into a bin, which is then going to be re-sterilized. Hopefully we won't need to use them because the supply chain will hopefully improve, but until that time comes, we have to take every measure possible. So the other part of this is, as healthcare workers on the front lines, we deal with the stress of possibly bringing this back to our home, our families, our kids. So we have to be extremely careful and diligent about hand washing and taking off our PPE as soon as we exit the patient's room. Hand washing and not touching one's face are of the utmost importance. But I have to say, as emergency physicians, we are doing a good job. We have in our healthcare system other hospitals that are able to lend us some of their staff to fill in some of the gaps, and we're very fortunate as a hospital system that we can do that. So that's a huge positive. One of the other deficiencies is that we are lacking the ability to test healthcare workers and staff in a timely fashion. The turnaround time is roughly 3 to 5 days. So that makes things a little bit more difficult in terms of deciding who can come to work and who can. If you obviously are displaying symptoms, you need to stay home. The spirit, however, of the collaboration and teamwork is really unprecedented as well. Everyone is really stepping up. The morale is very positive, and the community around us has been extremely supportive. We get food sent to us just about every day. So I can't thank everyone enough for really showing us the support. Just to end on this, look, if you're sick with some minor symptoms, cough, no shortness of breath, please, we urge you to stay home. the hospital is not the place for you. Obviously, if you're having more severe symptoms, please get in touch with your primary care physician and then give us a heads up if you need to come in. The bottom line is, we're going to get through this, and together we're going to make this this pandemic a thing of the past. Thank you.